pancreatitis just sucks rocks in so many different ways, even more so than a lot of other illnesses that cats get. I'll try to sort some of that out, give you some ways to figure out what's going on and what you maybe can try to do about it. Before we get to that, I do want to say this is the Hyperthyroid Cats channel. I'm Forrest Poston. Call myself teacher, talker, teaker, and cat dad, but I am not a vet. Keep that in mind. This is just what I have picked up along the way. Formal research, informal research. I do hope you will subscribe to the channel if you haven't done so. That does me a world of good. Please watch the other videos, which also does a world of good. I think you'll find some useful things there. Click the thumbs up button, click the notification bell, make comments, and just share the videos and channels. I got the subscribers I need, but just not the watch hours, so that I can put a little button on there that asks all you good people to help me out if you think this video helped you out. Now, pancreatitis. And as usual, this applies to non-hyperthyroid cats as well as those with hyperthyroidism. But also, like many diseases, pancreatitis does seem to be more common when cats have hyperthyroidism. I mean, it's throwing their systems off. The oral medication can cause some irritation, and you wind up with an unhappy cat. Now, problems with pancreatitis. Well, I guess it starts with some vets evidently still don't think there is such a thing. It is not the first diagnosis for many of them. And it is hard to diagnose because there may not be any really clear symptoms until it's really bad. And it may not show up on any blood work. Technically, high amylase can indicate pancreatitis, but cats can have high amylase and have nothing wrong at all. So that's not a lot of help. There is a blood test specifically for pancreatitis, but if you read the note below that test result, and always read the notes on those blood, first, get copies of the blood test results. Always get copies. Look at them, not just the numbers, but also the notes. You'll find underneath the test for pancreatitis that, if it comes back normal, says, well, acute pancreatitis is unlikely, but there may be chronic pancreatitis. The test for pancreatitis doesn't test for chronic pancreatitis. And there's a fair chance, especially if you have a hyperthyroid cat or an older cat, that chronic pancreatitis rather than acute is what you're dealing with. Now, essentially the treatment is the same, but you have to figure out that you need to start treatment. Now, there is a test that sometimes indirectly suggests pancreatitis. It's called GGT. Doesn't always, a lot of the test panels don't include it. It's technically testing liver, especially related to the flow of bile in the body. And there's the trick, because an inflamed pancreas sometimes pushes on the bile duct and causes the GGT to go up. So when I see high GGT on a test result, especially if there's nothing else showing, my first guess is that it's actually the pancreas, not the liver, and not gallstones, which would be another possibility. But I would treat for pancreatitis first, unless there's something else showing that it is bile, gallbladder, that sort of thing. So a lot of times it's just a cat's throwing up, not eating, seems to have discomfort in the abdominal area. And sometimes there's just nothing clear. It's just something's not right. And maybe you've tried treating for other things and it didn't work. Then I just guess pancreatitis. And the thing is, what you do for pancreatitis is largely very low risk, and it's going to help a lot of different things. You may actually never be sure if it was pancreatitis, but you end up with a healthy cat, and that's the point. So in a case like this, I start with what I call a shotgun approach, because it is just this wide doing everything rather than trying one thing at a time. So it would include subcutaneous fluids, which you can do at home, and I need to do a video about some of the tricks for that. Anti-nausea meds such as Cerenia or ondansetron, which I think is also Zofran is the brand name. Double check me on that. A pain medication, and I would generally use Buprenex. And I would include an antibiotic. And there's one of the points of disagreement. It used to be standard to include an antibiotic, and then studies indicated, well, maybe there is no bacterial infection. And then you find, well, in some cases there is. It's maybe secondary to the pancreatitis, not causing the pancreatitis. But again, it's one of those things, if you don't treat for it and it's there, you're screwed. If you do treat for it and it's not there, it doesn't matter. But you do need to use an antibiotic that won't further upset the digestive system. I prefer Zenequin. Very, very low digestive rate, very low risk of digestive upset. It's a strong, not the strongest, but it is a strong antibiotic that covers a wide range of things. And so many of the others, like Clavamox, any of the penicillin-based, risk of digestive upset is pretty high. And you kind of screw things up more rather than helping, which may be one reason some vets stopped using antibiotics instead of switching to a better one. I would also do a B12 injection at home. It's very easy to do. Can have the vet show you how. Now, some vets aren't familiar with using B12. They may object to using B12. It is a potentially marvelous thing that can help the kidneys, the digestive system, boost appetite. It just does a whole lot of good things. But the injectable form is much more effective than oral forms. So, but it's just tiny needle under the scruff and you're done. Those would be every 5 to 7 days for a few weeks and see what happens. I would also temporarily or permanently switch to an easily digestible, high-quality food. Now, there are what they call prescription diets that claim to be, easily digestible, but there are very few cases where I would use one of the, foods that comes from your vet. The ingredients are typically just not suitable for an obligate carnivore like cats. And that can mean some of those things are harder on the digestive system, which means harder on the pancreas. Temporarily, you can just use, some boiled chicken if your cat likes it. It's not a complete diet, but you can do that for weeks if necessary. I would, and I say this over and over again, a frozen or freeze-dried, good quality raw food. And you'll find the really good ones will say they're like 97, 98% meat, organs, and bones. And then you're looking at just 2 or 3% of added items that are supposed to be helpful. They're not necessarily going to be helpful in terms of nutrition because they're things cats don't digest well, but they can help in somewhat less direct ways. And there's just no two ways about it. Cats digest meat. That's what they are designed to digest. For humans, it can be harder on parts of the system. We aren't obligate carnivores. So don't fall for that reduced protein, reduced meat, nonsense. Meat is what cats eat. It's what they digest well, if it's good quality meat. Now, you can use something like slippery elm to help protect the digestive system if it's gotten irritated. 100 to 200 milligrams 1 to 3 times a day. It's probably not a critical thing for pancreatitis, but if the other things aren't quite enough, that's something you can add. With luck, if you start treating pancreatitis fairly early and with the broad approach, you can see improvement within a day or two. And now, when you see improvement, don't just stop treatment. You got to keep that up for a week or two. And just kind of keep your eyes open for indications because, older cats and particularly hyperthyroid cats are prone to pancreatitis, which makes it chronic pancreatitis. And, if you can just catch it early, and again, with these things that are very low risk, and you may find simply doing the B12 injections once a week prevents the outbreaks as well as helping in other ways, and a good quality food. Probably some other things that you can do if they become necessary. They don't come to mind, and I didn't make a list. The ones I've mentioned are the basic broad spectrum approach. I'll close with a bit of a story because this is, the differences in approach for pancreatitis, particularly if you don't know it's pancreatitis. We had a cat throwing up every 10 to 15 minutes all night long. Got him to the vet the next morning. And here we're talking acute pancreatitis. Vet drew blood and sent it out to be tested. And at that time, it took like a week to get the pancreatitis specific test result back. And he started treatment, fluids, pain med, antibiotic. I didn't mention an appetite stimulant. That is a possibility if needed, but generally if you reduce the symptoms, the appetite will come back. And, well, the vet mentioned, these are what you do if it is pancreatitis. These are what you do if you don't know, and it's something else. The test eventually came back positive for pancreatitis. By that time, the cat was doing much better. And the vet told us he didn't think the cat was going to make it. And if he had waited until he knew it was pancreatitis before he started treating for pancreatitis, the cat would not have made it. So consider, and if you really think pancreatitis might be the, and you don't have to know, if it might be the problem, treat for it. Don't wait, because pancreatitis can get bad in a hurry, and it is better to treat it when it's mild to moderate rather than waiting. So well, okay, I'm blanking out here. I think I had something to say, but I have said the main points. Pancreatitis is tricky. You may never know if it was pancreatitis. And even if it isn't pancreatitis, even if vets are right, if the handful who think pancreatitis doesn't exist, if they are right, these treatments will still correct whatever problem, well, most of the problems. Well, there are things you just can't fix. But don't be afraid to guess pancreatitis. Don't be afraid to treat for pancreatitis, even if the tests don't show anything at all. All right. I'm going to drink the rest of my tea, which at least does have a small amount of caffeine in it. And then I think may go downstairs and get something with more caffeine. Thanks for watching. Once again, please subscribe. Sorry I was a little scattered at times this morning. I'm also treating a couple of sick cats of our own, so that's got a bit of my attention. Please share, subscribe, make comments, watch the other videos, and good luck with the cats. So long.